I'm Dr. Jonathan Movson from Rhode Island Medical Imaging, and I'm in charge of informatics at Rhode Island Medical Imaging and also at two of our tertiary referral centers. I'm part of a blended private and academic practice. We have a total of 50 plus radiologists, and we have a residency program, and we affiliated with Brown University. And we have 6 outpatient offices. And then we also provide services at three hospitals that are affiliated with Brown. The benefit of lifeIMAGE is all to the patient. I think the biggest problem with healthcare is the fragmentation of healthcare. So patients are imaged in different places. It's very hard to take those images and put them all in one repository, in one medical record. lifeIMAGE for us has been helpful to facilitate that process. And how does that work? Well, basically we do a lot of outpatient imaging. We also see the patients in our tertiary care facility. Patients, we are subspecialized practice. The patients are seen in the hospital and they're seen in the outpatient setting. And so how do we bring those images acquired in the outpatient setting into the hospital? And so lifeIMAGE has facilitated the process of importing those images into our PACS, where they are available at tumor boards, they're available to referring clinicians, they're available to our subspecialists, they're available to us when we're comparing to prior studies, they're available to us when they're useful to us in the future as well as serving as a baseline before patients start therapy. So basically having as much of the medical record in one location is critical to taking care of patients. And lifeIMAGE has been invaluable to us in achieving that goal. This is new technology. lifeIMAGE is one of the early adopters of this technology, and we've worked very closely with their software engineers, their applications expertise, and we've been really impressed with. We've had a great experience with that. They've been incredibly responsive. They're open to ideas. They do what they say they're going to do. And it's been a very, all you can ask for is are people who are innovative, people who are responsive, and lifeIMAGE has come through in every way. So it's been a real pleasure to work with lifeIMAGE. One of the features about lifeIMAGE that we really have come to appreciate is the design. We think that it is a very smartly designed application. The user interface is simple, it's easy to negotiate, it's easy to navigate. So in terms of the workflow, patients are coming in and bringing these CDs from outside facilities. Referring clinicians are bringing in CDs. We usually have an administrator or secretary level person take those CDs, import it into the lifeIMAGE server, and then placing an order in our RIS, and then matching the order to the images and lifIMAGEs and pushing that to PACS to make sure it gets into the right patient jacket. Once it's in PACS, it is visible to us that it's an outside study, which is useful, but other than that, it's seamless, and it just presents as a prior for comparison. CDs were better than film, but they are very problematic. And so the question is, how can we exchange patient medical record, including their radiology studies, without placing them on a CD? And the lifeIMAGE solution is to place a box somewhere in the cloud, have clinicians push them to that box, have patients push them to that box, and then for us to be able to retrieve them in a safe way that guards PHI, and to safeguard the patient's identity and other important information, and then to be able to retrieve those images and have them readily available to us would be a big advantage.